We were quickly in the car and off to see Mrs. Marshall on nearby Crowhill Road. I'm glad we started there. It was a good first visit for Amanda to see. Hello, Jane Lee's health visitor.
Oh, yeah, okay. There you go. Just show you in there.
Hello. Hello there.
Nice to see you again.
Can I introduce Amanda to you? She's a student nurse who's with me learning about health visiting. Okay. So, how is little Alfie?
Oh, he's fantastic. Hard work, just like you said at antenatal class.
Oh, you've noticed.
Yes, we've noticed. 10 days have just flown by. Alfie's sleeping right now, though.
Oh, don't worry, I'm not going to ask you to wake him up just yet.
That's a relief. Don't get me wrong, he's gorgeous, but I don't think our lives will ever be the same again.
That's what everybody says.
Absolutely. OK, so this is my first visit and I need to remind you that my job is to support you all and make sure that Alfie gets off to the best possible start in life. So, to remind you, we normally visit at 4 to 6 weeks, 3 months, 6 to 9 months, and then again at 2 years.
Can we call you in between if we need help?
Oh, yes, absolutely. Remember what I told you in antenatal class? Health visitors are there to help when needed, especially checking up on Alfie's developmental milestones and advising you about any problems. Leslie, just to recap, it was a normal delivery with no excessive blood loss or problems. Your postpartum blood pressure was okay and everything is getting back to normal. No signs of infection or anything?
That's right. I was lucky, I suppose, especially reading all the horror stories posted on the Liz Viv page.
Oh, yes, people are always very keen to share their experiences on Facebook or Liz Viv or any of the other social networking sites. Now, let's talk about feeding. You said that you were going to breastfeed when I saw you at the last antenatal class, Leslie.
Yes, I did, and yes, I am. It's just really hard work.
But it's worth it for Alfie. How are your breasts? Any soreness or cracking around the nipples?
Breasts are okay. I'm just really tired at the moment. Not really getting any proper sleep.
Can I come in here, please?
Yeah, sure.
I'm starting to feel like a bit of a lemon, to be honest. I can see how tired Leslie is with the feeding, and there must be something I can do.
One of my Liz Viv friends did suggest maybe missing a feed and topping up with formula, so then Gary could come in and help.
Yeah, so that Leslie could get some sleep.
Well, I understand your concerns, but it's not as simple as that. It's important that you get into a regular cycle of feeds, and this way the body makes the hormones that can promote good supply of breast milk.
There must be something I can do, though.
Oh, yes, there's lots that you can do. You can cook for the both of you. You could change his nappy. Give him a bath, take him out in the pram, pack a bag up if you're going out for the day. All these sort of things will help to take the pressure off Leslie.
Give him a bath?
Yes, why not? It's easier than changing a tyre on a car, you know. Leslie can show you how to do it. Just the skin-to-skin contact helps. Babies respond positively to skin-to-skin contact with their dad as well as their mum, you know. Right. Now I've run through the family medical history, and there's no history of diabetes, asthma, eczema, epilepsy, and all the other things I asked about. Is there anything else in the family?
My brother was born with an undescended testicle. He had to have an operation to get it fixed. And he said Alfie was born the same way.
Oh, OK, right. I'll make sure that the GP gets that information, as he'll be doing a medical check on Alfie in 6 weeks, just before his first immunisation. Undescended testes usually sort themselves out, but if there's still a problem when he goes to see the GP, then the GP will make a referral to the paediatrician at the Children's Hospital.
Okay, it's worrying because I read that just an undescended testicle can really increase the risk of testicular cancer when he's an adult.
Well, the risk of testicular cancer is very small, and having an undescended testicle does increase that risk, you're quite right. But seeing as the risk is small in the first place, there is only just a small risk. But most descend naturally in the first few months. I'll make sure that the GP gets to know about this.
Okay, thanks, Jane.
Now, we'll just talk about how you're feeling, Leslie, and discuss sleeping arrangements and a few other things. And then I'm afraid I'm going to have to ask you to wake Alfie up so that I can have a look at the little fella.
Thought you would.
Amanda settled into the placement well. Once we'd got the little difficulty of the mobile phone and texting out of the way, before I knew it, I was back at the Marshalls again with her, checking up on Mum's mental health, as we always do with new mums.
He always seems to know when you're coming. He's asleep, I'm afraid.
Oh, don't worry, it's okay. There's a few things that I want to talk to you about before we have a look at Alfie. Can you remember Amanda, my student from last time?
Yes, hi Amanda. You're learning plenty.
Yes, a lot, thank you.
So, it was 4 weeks when we visited last, and is Alfie doing fine?
Yes, he is. And Gary's becoming a real expert at changing nappies.
Oh, good. And what about you? How are you?
Me? I'm fine. Just tired. But we're getting on well now. A routine has been established.
You will know, Leslie, that some women get very down after they've had a baby.
Postnatal depression, you mean?
Well, we don't call it that anymore, but that's the idea. I'm wondering whether you might just fill in this simple screening form, just to see how you're getting on.
Well, I'm okay, but if you feel it'll help, pass it over.
Okay, now take your time, there's no rush. Just mark the boxes to say how you felt over the last week.
There you go.
Thank you.
Am I okay?
Looks okay to me. This score's well within the normal range.
I told you I'm fine. I just need more sleep.
Yes.
While you're here, can I ask you something?
Of course.
Could you tell me a bit more about Alfie's immunisations, please?
Actually, that was the next thing I was going to do. Have you got that book that I left here last time? Birth to 5? Here we are. Now it's on page 99. Here we are. Immunisations. Now, when Alfie is 8 weeks old, he'll get his first round of immunisations. This will protect him against diphtheria, whooping cough, tetanus and polio. He'll also get immunised against Haemophilus, influenza type B and pneumococcal infection. They'll do all this at the health centre.
So do I arrange with a practice nurse and they'll do all that?
Yes, that's all there is to it. Any other questions?
Well, I've read some scary things online. You know me and my Liz Viv page.
Well, I know that there are some scary stories out there, but that's all they are, stories. The hard medical evidence from trials all around the world all say the same thing. Immunising your child is the safest thing to do and infinitely safer than doing nothing.
Yeah, I know, but when it's real and it's your own baby, as opposed to an argument on the television, it's different. It makes you think different.
I know it is different, but believe me, this is the right thing to do. Check out the website. It's on page 103 when you have a minute.
Sorry, I'm just being really silly. It's just everything that you read online.
Do you know, I wonder whether it might be a better idea for you to meet mums face-to-face rather than online.
Where's that?
Well, St Peter's Primary School has a Sure Start Centre connected to the nursery there. They have regular mother and baby sessions. You could meet up with other mums, just like yourself. You can have a coffee and a chat. They're a mine of information about all the things that you're going to have to do with Alfie next, like weaning him, getting him walking. You're having potty trained before you know it. Here, here's their leaflet.
Okay. Do I just turn up?
Well, the next session's on Thursday, so I'll have a word with Steph, who runs it, and she'll be expecting you. They're very friendly, you'll be fine.
I might do that. Get me out the house.
Exactly, you don't want to get stuck in the house with Alfie, no matter how sweet he is. You need to get out and socialise.
I know, that's exactly what my mum's saying. It's just easily said than done.